Let's talk about a man named Dr. William Norwood. To some, he was an absolute genius, a surgeon with hands that could fix the tiniest, most broken hearts imaginable. But that same relentless drive, the thing that made him a hero, also set him on a collision course with tragedy, ethics, and pretty much the entire system he helped create. So picture this, it's February 19th, 2004. At 1 minute to 1 in the afternoon, Dr. Norwood is, without a doubt, at the top of the world. He's the chief of surgery at a world-class heart center, a place he basically built from scratch. He's famous for inventing a procedure that saved thousands and thousands of babies. And then, literally in the span of 60 seconds, his career at that hospital just ends. He gets called into a conference room, he's told they need new leadership, and just like that, everything he built is thrown into question. So that's the big question, right? How does a medical giant, a man his own colleagues called a genius, fall that far, that fast? Okay, let's get into it and figure out what on earth happened here. It all started with that meeting. We really need to unpack the official reasons for such a dramatic, sudden firing. So the hospital officially said it was because of an investigation into an experimental device. The main accusation was that he failed to get proper informed consent from the parents. But it wasn't just the firing. It was the way they did it. This man, a legend, whose name is literally in medical textbooks, was walked out of the hospital he founded by a security guard. Humiliating. And afterwards, this is what Norwood himself said. "The world is getting tough, It's such a quiet, almost wounded thing to say. It really gives you a glimpse of a man who felt totally blindsided. A pioneer who maybe thought the rules of the game had changed, while he was focused on changing medicine." Now, to really understand the controversy, you have to understand why this guy was considered a living legend in the first place. So let's rewind a bit and look at the impossible medical puzzle he solved. This is Hypoplastic Left Heart Syndrome, or HLHS. For decades, if a baby was born with this, it was a death sentence, period. They essentially had half a heart. The left side, the part that pumps blood to the body, just wasn't there. There was no cure. There was zero hope. And this is the masterpiece he came up with. The Norwood Procedure. I mean, it is an unbelievably audacious 3-stage replumbing of a baby's entire circulatory system. In stage 1 on a newborn, he literally rebuilds the aorta and rewires the heart so the one good ventricle can do the work of 2. Then in 2 more surgeries over the next couple of years, he reroutes all the blood flow in a way that takes a massive load off that single ventricle. It was just a complete revolution in heart surgery. But look, this kind of breakthrough wasn't easy. It was born from a lot of failure. His first attempts back in 1979 were heartbreaking. Children died. But the families, they understood. They knew they were part of something bigger. So when that first patient finally survived the whole thing in 1982, man, it was a breakthrough that changed everything. Which brings us right back to Namor. Because that same relentless drive to push boundaries, the very thing that made him a hero, well, that's what ended up getting him into so much trouble. And the best way to understand this whole mess is through the story of one little girl, McKenzie Madden. Her mom, Michelle, brought her to Nemours specifically for Dr. Norwood. She was told about a new, cutting-edge procedure using a stent, but after her second surgery, McKenzie had terrible complications, and she died. It was months later that Michelle was watching the news and suddenly realized that the experimental stent her daughter got was at the very center of the scandal. At its core, the official dispute boiled down to this. The hospital claimed they couldn't find a critical consent form for one of the families. But Norwood's lawyer said, "What are you talking about? We have it right here." This one single document became the flashpoint for everything. And this quote from another mother at the hospital that summer, it just paints a terrifying picture. Parents were scared. Even the nurses were whispering to them, saying that an alarming number of kids were dying after surgery. They felt something was going terribly wrong. But what happened at Nemours, it wasn't some isolated incident. To really get the full picture, you have to see Norwood's entire career as this constant tug-of-war between progress and protocol. Years before any of this, back in Philadelphia, a jury hit him with this absolutely staggering verdict: $55 million. Now, they eventually settled for less, but the case itself was a huge red flag. It was all about allegations that he changed a surgical plan at the very last minute without what the family felt was proper consent, and it led to a horrible outcome. And yeah, it wasn't just a one-off. Over his 10 years at the world-famous Children's Hospital of Philadelphia, he was sued at least 25 times. So this wasn't something that just popped up at Nemours. It was a pattern. Clashing with patients over what was and wasn't okay was a reoccurring theme his whole career.
To really understand him, you have to see how he saw himself. He looked up to this long line of medical mavericks. You know, these rebels who broke all the rules, got fired for it, and then later were hailed as geniuses. In his mind, he was just carrying on that tradition. And this is just perfect. This lyric from American Pie is what he used to describe his career. He saw himself and his surgical team as the players, trying to move the ball down the field. And the marching band, well, that was the hospital administration, the lawyers, anyone who he felt was just standing in the way of progress. So that brings us to the real heart of the issue. This massive ethical problem that's so much bigger than just one surgeon or one hospital. Just look at this comparison. Norwood flat out said he thought informed consent was a legal term, not a medical one. He argued there's no way parents could really understand the complexities. But that flies directly in the face of the modern standard of care, which says you absolutely have to explain the risks, the alternatives, and give people data, especially when you're trying something new. And this is why the whole thing got so explosive. By the time this was happening, in the early 2000s, the standard Norwood procedure had become incredibly safe. I mean, look at these numbers. Survival rates for stage 2 and 3 were hitting 96% or higher at the best hospitals. So here's the billion-dollar question. Why take these huge, unknown risks on an experiment when the proven method was already so successful?
And that leaves us with this really tough, really uncomfortable question. We all want medicine to advance. We all cheer for the mavericks when they pull it off. But who pays the price when they don't? Is it okay for a genius to keep pushing the envelope as long as it isn't your child on the operating table? In the end, there just aren't any easy answers. All we're left with are the haunting words of a mother who has to live with these questions for the rest of her life. For Michelle Madden and all the other families in this story, the cost of this progress was everything. And that question, what if, is never, ever going away.